Revised guidelines on transport capacity as residents say goodbye to curfew. We begin with the son and namesake of former dictator Ferdinand Marcos, Bongbong Marcos, branding as nuisance the petition by some groups to cancel his certificate of candidacy. The petitioners meanwhile vowed to go all out until the end, despite the lack of financial resources. Our Rex Remitio tells us more.
Alam ho ninyo, kasuklam-suklam itong ginagawa ng mga taong ito dahil imbis na ang COMELEC ay mag-concentrate sa paghahanda sa ating manalalapit na May 2022 election.
Bongbong Marcos's camp is calling the petition to block his candidacy for president as a propaganda. Although Marcos's lawyer and spokesperson Vic Rodriguez claims they have yet to receive and read an official copy of the petition. He insists Marcos's rivals in the presidential race should fight with them fair and square.
I am sorry to disappoint the yellow wannabe political assassins. We are not going to engage them in gutter politics.
The lawyer says Marcos's campaign is about the future of the Filipino people and recovery from the pandemic. The petitioners are denying it's about politics. Their spokesperson says it's about upholding the truth. They also vow to battle it out until the end despite lack of financial resources or political connections.
Bakit? Dilaw ba kami? O kahit sabihin nila, pula kami? Bakit? Merong bang kulay ang katotohanan? Sila nga ang dapat sumugot niyan eh.
Political analyst Dennis Coronacion says this development will affect the dynamics of the presidential race, leading to the deadline of the substitution of candidates by political parties by November 15. Coronacion also says donors can view the petition against Marcos as an additional risk to his candidacy.
Well, it can go both ways. There's always that possibility that it can be beneficial for Bongbong Marcos, or it could be disadvantageous for him, for his campaign. Beneficial, as you said, in the sense na, there might be an outpour of sympathy coming from those who are still undecided. Maaring magkaroon ng dent doon sa kanyang claim that he can lead the country because of his moral behavior.
Marcos's supporters, meanwhile, held a Twitter party using the hashtag #ProtectMarcosJr. It trended in the Philippines all day long. Critics have been saying this was driven by troll farms. The Marcos camp is denying it, saying Bongbong Marcos has just too many supporters. Rex Remitio, CNN Philippines.
Work will soon begin for the Commission on Elections to resolve the plea to stop Bongbong Marcos from joining the 2022 presidential race. The petition to cancel his certificate of candidacy will be assigned to a division of the COMELEC Bank composed of 3 commissioners.
Wala pang rap. Ang irarapo, lahat ng kaso ng cancellation. So, inaayos pa ng clerk of the commission yung mga kaso to prepare them for raffle.
The period for the filing of petitions to cancel COCs ended Tuesday, November 2nd. The Marcos camp will be given 5 days to respond to the petition, followed by a pre-conference. After that, both parties get 3 days to submit their final responses before the division issues a ruling. According to the COMELEC Law Department, either party to the case may file an appeal to the 7-member COMELEC Bank. A possible further appeal will go to the Supreme Court. According to the election law, petitions to cancel a COC must be resolved not later than 15 days before the May 9 election day, giving the poll body until the end of April to decide. Similar pleas to cancel the COCs of 2016 presidential candidates Rodrigo Duterte and Grace Poe were resolved within 3 months, although Poe's case reached the Supreme Court after the COMELEC Bank initially said she was disqualified from the race due to doubts on her citizenship as a foundling. When asked to comment on the matter, another presidential aspirant, Senator Manny Pacquiao, says he is sure Marcos's lawyers will handle the issue. Fellow aspirant Senator Bato de la Rosa, meanwhile, says the law should prevail, but hopes Marcos will still be allowed to run. The country lists nearly 1,600 new COVID-19 infections. This is the lowest single-day increase reported since February 24, when new cases were at 1,557. Independent researchers earlier projected that new infections will drop to less than 2,000 daily by the end of the month. Meanwhile, there are over 38,000 people currently sick with COVID-19. This includes data from 7 laboratories. Close to 4,300 people recovered, while 186 others died. A new front in the nation's fight against COVID-19 as government expands vaccination to minors ages 12 to 17. The rollout in Metro Manila yields a significant number of young people accompanied by their parents eager to see their kids get the life-saving protection. Our senior correspondent, David Santos, reports.
Long lines form outside this Quezon City school Wednesday morning as eager parents accompany their children to get the COVID-19 vaccine. Among them, this mom with 2 kids.
Para po makabalik na sa face-to-face classes at saka para makabalik na po sa outdoors.
Unlike when the country began the rollout of the vaccines 8 months ago, this time the process is more organized. This despite more stringent measures like requiring kids to be escorted by parents. Legal guardians need to present authorization letters.
Importante kasi dapat pareho silang may consent para at least, and also kung may something happens to the child or if we have any other questions that the child cannot answer, yung pong magulang ang sasagot.
Some areas, however, still have a relatively low turnout. Officials attribute this to either vaccine hesitancy of parents or problems in schedules.
Number 1 po kasi may pasok sila ngayon eh. So naka-online classes pa rin po sila ngayon. Yung iba nga po dala yung kanilang mga iPad at saka yung mga laptop nila.
For some parents, it also means skipping work to accompany their kids.
Okay lang po yan, basta mabaksin po siya. Kasi ano lang naman po yan eh, 1 day lang naman po.
In Mandaluyong, the city is hoping to assign more pediatricians in its vaccination hubs. Most of its pediatricians have been busy in health centers immunizing kids against common illnesses like measles.
Swerte kami. Nandiyan po ang San Miguel Corporation. Yung doctors sila and nurses sila, they're still here up to now.
With the start of the inoculations in Metro Manila, the health department is targeting to reach at least 80% of close to 13 million minors ages 12 to 17 nationwide. Unless supply problems arise, local governments are expected to carry out the vaccinations by Christmas. David Santos, CNN Philippines.
President Duterte orders the use of police and military assets in the distribution of COVID-19 vaccines. He wants the doses delivered straight to municipalities to address delays at the local level. Mr. Duterte also wants local officials to be ready with people who can administer the shots immediately upon delivery. This move comes after the president expressed disappointment over the weak and slow distribution of vaccines on the regional and provincial levels. Here's the president in his own words.
I will hold each and every LGU accountable for this. Ang paglabas ng bakuna dito sa national, medyo okay. Ang problema pagdating doon sa provincial, regional level, so sabi ko, gamitin na lang ang mga air assets ng PNP, pati AFP. Pag-deliver doon sa aeroplano, tapos pagdating doon yung TOG, yung mga helicopter nandyan sa will take over. Sila na ang maghatid doon sa mga municipal governments.
The president also reiterated his order to the Interior Department to sanction local governments that fail to perform and administer the coronavirus shots promptly and efficiently. Private hospitals say they will give PhilHealth another chance to settle its debts. Otherwise, they will push through with their plan to sever ties with the state's health insurer. The Private Hospitals Association says in a meeting Tuesday, PhilHealth President Dante Gueran promised to meet with hospital managements in person to discuss the terms of payments of their reimbursements. Degrano says the meetings between PhilHealth and hospital managements may start within the week or early next week. He says hospitals are fed up with PhilHealth's unfulfilled promises and want a 70 to 90% outright payment of unpaid claims. Based on PHAPI's estimates, the state insurer owes their members at least 20 billion pesos.
Nati-drain na resources namin. We are bleeding. At wala namang bumabalik na blood sa akin. They have all the mechanisms to safeguard the release of this thing. Hindi ko lang alam kung bakit sobrang nilang hinihintitan to the point na parang talagang ayaw nila magbayad.
Malacanang and lawmakers have again called on PhilHealth to pay the hospital debts. Coming up on Newsnight, the Education Department identifies the participating public schools for the pilot run of face-to-face classes this month. And more passengers are allowed on public transport beginning tomorrow. Find out what changes to expect when Newsnight returns.
Nangyari sa'yo? Ba't nakasimangot ka? Alam ko na. Masakit ang katawan mo, ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya sa bawat pahid.
Welcome back. The Education Department bears plans to seek President Duterte's approval to include more schools for the limited face-to-face classes. DepEd Secretary Leonardo Briones says Metro Manila schools may be included in the second batch of the pilot run, although she points out the final say will come from the Health Department. Briones believes this could be done given that the COVID-19 situation in the country is improving. The government has identified 100 public schools for the limited in-person classes set to begin this month. Evaluation of the 20 private schools that will be joining the pilot is still ongoing.
Susulat kami, naghahanda na kami ngayon ng report sa Presidente na kung pwede nang dagdagan yung 100 na pinayagan niya, ay talagang magdagdag tayo dahil maganda naman ang balita na lumalabas ngayon.
It's welcome news for some commuters as authorities give the green light for public transport to increase passenger capacity. A day before its implementation, however, the Transportation Department laid out some changes to the rules. Let's get the details from our correspondent, Paulo Barcelon. Paulo, can you tell us what these changes are?
The biggest change so far is that people won't be allowed to stand inside modern jeepneys and buses. Now, this is a major policy change from what we've been reporting last week, as the Transport Department even outlined how people would be allowed to stand inside these vehicles. Now, these changes were made, the Transport Department explains, due to enforcement concerns.
Nakita po natin na baka magdudulot ng kalituan kung meron pong nakatayo sa loob na makikita natin sa mga pampublikong sasakyan. At minarapat na lang po natin na i-reconfigure kung saan po pwedeng umupo sa loob ng pampublikong sasakyan.
Compared to guidelines released last week, which showed passengers standing inside buses, there will now be passengers sitting side by side on the first few rows in front of coach-type buses. Transport officials also released guidelines on seating capacities for low-floor buses or those commonly used along the EDSA busway. Standing will also no longer be allowed inside modern jeepneys, while in traditional jeepneys, markers will replace plastic barriers to indicate social distancing. The DOTR also set passenger limits for UV express vehicles, 13 passengers for the so-called commuter-type UV Express vans, 11 passengers for vans with both front and perimeter seating, and 7 passengers for Asian utility vehicles. The Transport Department also reiterated that marshals will be deployed to the LRT, MRT, and PNR to ensure that 70% capacity regulations on trains will be properly implemented. As with other vehicles, making phone calls inside trains are still not allowed, and passengers will still have to wear face masks and face shields. Transport Assistant Secretary Steve Pastor says they will evaluate the results of this pilot run of increased capacities before deciding on whether or not to increase the current 70% to 100%. These changes will be implemented in these changes will be implemented in Metro Manila, Laguna, Cavite, Bulacan, and Rizal. Back to you.
Paulo, so how about taxis and ride-hailing services? Any new guidelines?
Well, Ruth, LTFRB Chairman Martin Delgras said the taxis and TNVS will now be allowed to entertain people seated beside windows. For example, people could now sit on the front seat or the one beside the driver. LTFRB is also reviewing the number of available taxis and ride-hailing cars with announcements about them to be made soon. As for motorcycle taxis, the Transport Department says it will defer the ruling on plastic barriers to the National Task Force. Back to you, Ruth.
Paulo Barcelon there reporting. Movement of more people will soon be allowed as well. This as authorities announced the lifting of the unified curfew in Metro Manila beginning tomorrow, November 4th. But the directive is still subject to the existing rules of local governments on minors or those below 18 years old. Metro Manila Development Authority Chairman Ben-Hur Abalos explains this is to allow malls to extend their operating hours ahead of the holiday rush. He says mall operators have agreed to open from 11 a.m. to 11 p.m. on weekdays and 10 a.m. to 11 p.m. on weekends starting November 15th. Currently, curfew hours in the capital region are from midnight to 4 a.m. Despite the further easing of pandemic restrictions, the Dolomite Beach in Manila Bay will remain closed to the public. The Environment Department says this will last until the government finishes the rehabilitation project. The DENR plans to stretch the artificial beach from 140 to 500 meters. It will also look into the drainage system and work on making Manila Bay swimmable. The agency hopes to complete the project before year-end.
Ngayon po, isasarado natin para bigyang daan ang pagtatapos po ng mga ibang gawain na gagawin natin doon. Kasi ang gusto po ng ating interagency task force at ng ating kalihim na para mag-enjoy po yung ating mga kababayan, ay tapusin na po muna natin ang lahat.
Guidelines for picture taking and other activities in the artificial beach are in the works. The Dolomite Beach saw huge crowds when it was temporarily opened last month. The DENR vows this will never happen again. An investigation is underway to prevent similar incidents. A Manila Bay ground commander was sacked following the overcrowding. In news overseas, a critical turning point in the global health crisis. Children aged 5 to 11 years old in the United States are now rolling up their sleeves to get protection against COVID-19. CNN's Britt Conway gives us a look at the first day of the rollout.
And there it is, Pfizer's COVID-19 vaccine for kids 5 to 11 going into little arms already after getting emergency use authorization from the FDA and then the CDC's recommendation. These kids in Connecticut lined up for their first shot Tuesday night. The same night the vaccines arrived at this Ohio hospital.
Right there, it's 1,000 doses.
And at this hospital in Texas. And Pfizer is packing up and shipping out millions more. There are about 28 million kids 5 to 11 who are eligible to get vaccinated now.
It will be 1/3 the dose, but it's still a 2-shot series 3 weeks apart.
Possible side effects include arm soreness, fever, fatigue, and headache.
And I think whatever side effects we see really have to be compared against the risks of not getting the vaccine. More than 8,300 children in this age group have been hospitalized due to COVID-19. A third of them ended up in the ICU.
Children now make up a disproportionate number of new COVID-19 cases, accounting for a quarter of all the new cases last week. But health experts believe this vaccine, 1, 2, 3, poke, will change that.
If we have safe and effective vaccines, why wouldn't we make those available to families to make that decision and protect their children?
I'm Britt Conway, reporting.
World leaders making another big commitment during the crucial COP26 summit in Glasgow, Scotland. European Commission President Ursula von der Leyen announced a global pledge to cut methane emissions by 30% from last year's levels by 2030. She says this will immediately slow down climate change, as methane is an extremely potent greenhouse gas. The U.S. slams China for skipping the conference, but Beijing now appears to agree to the target of limiting global warming to 1.5 degrees Celsius. China's special envoy maintains his country is not resisting the target after its earlier reluctance to commit to the figure. South Africa will also get aid to help fund its transition away from coal. Actor Leonardo Dicaprio was also at the summit. He's been a United Nations climate change representative since 2014. Still ahead on Newsnight, love wins for actress Kristen Stewart. She reveals her engagement in a surprise announcement. And speaking of surprises, a lot is in store for fans of singer Lorde. More about her new music when we return.
O, anyari sa'yo? Ba't nakasimangot ka? Alam ko na. Masakit ang katawan mo, ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya sa bawat pahid.
Welcome back. Another win for our Tokyo 2020 Olympic boxing medalists, as one of the country's largest companies makes good on its pledge to give them financial incentives. San Miguel Corporation President and CEO Ramon Ang personally handed out cash rewards worth 2 million pesos for bronze medalist Yumir Marshal and 5 million pesos to silver medalists Carlo Paalam and Nesty Petesio. He also wished them good luck as they gun for the gold medal in the next Olympics that will be held in Paris, France. Ang also said they will provide the three boxers with any SMC business of their choice that they can put up in their respective home provinces. All of them are from Mindanao. Earlier, SMC gave 10 million pesos to the country's first Olympic gold medalist, Heidelin Diaz. Congratulations are in order for award-winning actress Kristen Stewart, who just got engaged to screenwriter Dylan Mayer. In an interview, the Twilight star revealed that Mayer, her girlfriend of 2 years, was the one who proposed. Stewart also said she wants a simple celebration for them to recite their vows without walking down any aisles. The actress is starring in a biopic about Princess Diana, Spencer, set to hit theaters this month. Meanwhile, another celebrity is bringing the party to her fans ahead of her 25th birthday. Grammy winner Lorde celebrates with a week of exciting releases. The New Zealand singer dropped the music video for Fallen Fruit, and there's more to come, specifically 2 more songs from her album. Lorde announced that the deluxe edition for Solar Power, previously only available on a music box, is set for digital release on Friday. This will contain bonus tracks Helen of Troy and Hold No Grudge. And in the United States, a Texas bar is giving Mariah Carey's mega holiday hit the silent treatment. Is it too soon for the Christmas classic? Mariah doesn't think so, but the bar does. CNN's Ginny Moose reports.
when Mariah Carey sings, some want a lot less of this song, which explains why a self-described dive bar in Dallas put up a sign on their jukebox that has Mariah fans up in arms. Mariah Carey's All I Want for Christmas Is You will be skipped if played before December 1st. After December 1st, the song is only allowed one time a night.
I don't hate Mariah Carey and I don't hate Christmas.
But the general manager of Stone Lee P says customers play Mariah's mega hit too often and too soon before Christmas. So the staff is on high alert.
Once we hear those twinkles, we run for the remote. It's really just a button that we press skip.
To skip Mariah long before she gets to the title. Fans are outraged if I see that sign, but amazingly, it's never been defaced and they've put it up for a couple of years. Some were defiant. I will be streaming it 1 million times this Christmas season and the next 2. Even Mariah herself reacted. Watch the bar manager's eyes when we tell her that.
No!
Yes! Someone posted, "Is this the war on Christmas?" And Mariah responded with herself in armor, ready to do battle. She also posted a video of herself destroying the knot in It's Not Time. It's time for Mariah's favorite season, Christmas. But plenty of commenters supported limiting the song to 1 play per night, noting this needs to apply to all Christmas songs and become a constitutional amendment. The bar manager says it's really just a joke, meant to be funny. Is not this. Jeannie Mose, CNN, New York.
It's 52 days before Christmas, and that's it for tonight. I'm Ruth Cabal, sitting in for Pia Ontiveros for Newsnight, where we go above and beyond the headlines.
O, anyari sa'yo? Ba't nakasimangot ka? Alam ko na. Masakit ang katawan mo, ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya sa bawat pahid.
RPN, Radio Philippines Network Incorporated, DXPO. Presence sa Sindautso sa bayan sa inyong radyo. RPN DXKO, ang radyo ronda dini sa Naglayan sa Cagayan de Oro. Sibiyahan na may balaon sa katawhan, andang na serbisyo sa tanan. Ang RPN DXKO Radyo Ronda, sakop sa KBP, kapisanan ng mga broadcaster ng Pilipinas.
Extended families are common in Filipino households. Our grandparents sometimes live with us, and their golden years are special. It's a time to slow down, relax, and enjoy life. And for us, a time to give back to them. But aging comes with other challenges, so caring for our elders requires a lot of knowledge and a little understanding. On the program today, we'll give you tips on how you can take good care of your parents or lolos and lolas. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. As people get older, their sense of hearing, smell, taste, and touch get weaker. Their physical appearance and their ability to perform daily tasks also changes, which may lead to some form of dependence. If we have older adults living with us, it's important that we know how to take care of them when this happens. Let's welcome our guests for today. With us is Dr. Mark Henry Hoven. He's a geriatrician from the Medical City and St. Luke's Global City. Also with us is Ms. Emelita Ong Lavilla. She's a nutritionist, dietitian from the Philippine General Hospital. It's inevitable that older adults face a number of health challenges, and being aware of them can help us better address them. Dr. Mark, what are some of these age-related conditions? Some of the conditions na pangkaraniwan makikita natin kapag tumatanda na ang mahal natin?
It's very common to see a lot of degenerative changes as people get older. So yung joints natin nagiging nawawala na yung cartilage doon. People suffer from osteoarthritis. So a lot of times sumasakit yung tuhod nila pag naglalakad, lalo na yung the heavier set individuals when they were much younger. They feel the stresses as they get older. Isa pa dyan is yung osteoporosis, yung buto natin nagiging marupok, becomes brittle as we get older. You lose that estrogen for females and maybe testosterone drops as men get older. So mas nagiging marupok, mas high risk for fractures if they fall. Meron din tayong neurodegenerative changes such as dementia. Yung pinaka-common, yung Alzheimer's dementia na common in this age group. Remember yung common things being common, we get them as we get older, like yung hypertension, coronary artery disease, mga diabetes, cholesterol issues. It goes up as we tend to age kasi dala-dala natin itong mga to.
You make an interesting point, Dr. Mark, about the common things being common, coming out, yung mga comorbids like hypertension, diabetes. Are these things that are inevitable when someone gets older, or is there ways that someone may prevent this?
Part of this is from genetic risk factors that we have. Our parents have diabetes, yung risk natin mas tumataas, or hypertension for that matter. Pero a part of the equation is yung lifestyle natin. If we like to take a lot of salt in the diet, yung risk of having hypertension goes up, as well as yung mga carbohydrates and such things. And eventually, these things will increase our risk for heart disease as we get older and stroke. So the solution to that is, as we are younger, we have to foresee our future, tingnan natin what lies ahead, what things may we encounter, and we have to live a healthy habits, because eventually these habits, although it's not, wala tayong nararamdaman ngayon, eventually our bodies will eventually feel the burden of this.
Before any of these challenges become serious, Ms. Emmy, how can we in our younger years ensure that we are prepared when this comes? Ano kaya yung mga dapat kainin? Ano yung mga dapat na healthy habits ang dapat meron tayo habang maaga pa?
Much is attributed to the genetic factors, pero marami din po ang role na nagagawa ng nutrition. Kasi yung nutrients po, whatever is needed, sabi nga yung nutrients, it's from womb to tomb issue. Kasi yung pong mga nutrients, some of them are used for structural components ng katawan natin, parte ng muscles, parte ng cartilages, ng mga brain, at saka ng bone structure. At the same time, kailangan siya for the normal functioning.
Dr. Mark, pag-usapan natin itong presbycusis o yung paghina ng pagdinig.
Very common in the elderly population. Sometimes hindi lang tayo ganun ka-aware, and there are signs and symptoms to know kung meron ba tayo nito or wala. And usually yung common is yung relatives natin sinasabi, masyadong malakas yung television volume mo. It's too loud, but if you are the patient, feeling mo it parang normal lang siya for your hearing. And then sometimes when you're in a very noisy room, maraming noise, extra sounds, it's difficult for you to understand yung sino kausap mo. And the problem with this is eventually it can lead to depression in somebody who has hearing issues as well as dementia. It's very common for them to have behavioral changes kasi hindi nila naintindihan yung sinasabi ng caregiver nila, ng kamag-anak nila. So sometimes they become more confused.
What are the options of someone who has presbycusis or nag-uumpisa na humina ang pandinig nila? What are their options, Dr. Mark?
First, you have to talk to your friendly ENT specialist kasi sometimes may mga things na nangyayari, yung simple things being common na may tutuli tayo doon. As people get older, yung tutuli, mas nagiging drier siya. mas very common siya na nai-impact sa loob ng tenga na bumabara doon. And that can simply be addressed by the ENT specialist with some liquid they put there to soften it up and irrigate it and remove yung tutuli, yung cerumen. Siyempre, you have to have a formal evaluation to figure out ano bang type of hearing loss we have, because there are some hearing loss that might get better with hearing aids that might help the person comprehend more.
Ngayon, Ma'am Emmy, when it comes to nutrition, what is vitamin B complex? Paano ito makakatulong sa isang nakatatanda na?
Sa hearing, sinasabi din importante yung vitamin B12 or cobalamin. So ito din yung kailangan para dun sa structural needs nung tenga o ng mga cartilage po. So ang vitamin B12 naman, makukuha siya from eggs at saka yung mga poultry at saka meat products po. So kung balanse naman or nakakakain naman ng elderly natin ng sufficient amounts nitong eggs, proteins, and fish, hindi naman siya magiging deficient with vitamin B12 or cobalamin.
Now, Dr. Mark, what can we do to understand the needs of the elderly more adequately, or how can this be addressed? Should we have a talk with our grandparents or lolos, lolas about their specific needs?
What I find easy sometimes is you just talk to them about their life stories, and within that conversation, usually sasabihin na nila yung mga issues nila sa life and things they want to achieve, and things they might find depressing or lacking in their life at this point in time. So just have an open communication with them, kasi most of the time, maski hindi specific yung tatanungin mo na ano ba problema mo sa buhay, they will let you know just by listening to their story. So listening is very important.
How important is the mental state of our loved ones, our elderly loved ones, as opposed to their physical state as someone grows older?
For example, depression in the elderly is very common. Hindi lang tayo masyadong aware. For somebody who's much younger, if my girlfriend broke up with me, I'll go to the doctor and tell the doctor, "Doc, I'm sad, my girlfriend broke up with me." But if in the elderly population, they lack that awareness na malungkot sila. So it manifests with different things like appetite. Usually, hindi masyadong kumakain, na they're starting to lose weight, or sometimes the relatives feel that nag-uulyanin na yung pasyente, nagkakademensya na, hindi niya maalala yung nababasa niya sa dyaryo or napapanood niya sa TV when they ask the patient, ano yung napanood mo after the show? And it's not really because of dementia, they were just not paying attention, their mind was wandering off elsewhere. So it presents differently. Minsan sleep naman yung problem, na lack of sleep. So those are common scenarios that relatives bring their patients to see us sa clinics. But if you prod further, malalaman mo na maybe this person has dementia. It started after a death of a spouse or some issues in the family. Doon mo siya makikita.
How can we care for our elders? How can we show them our love and support? Stay with us on MedTalk Health Talk, only on CNN Philippines.
Sa'yo, ba't nakasimangot ka? Alam ko na, masakit ang katawan mo ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya sa bawat pahid.
I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, your partner in healthcare. The well-being of our parents is our ultimate wish as they age. Now, essential to their physical health as well as their sense of dignity is ensuring that our elderly loved ones are able to do their daily living requirements to some degree at least. Now, Ms. Emmy, pag-usapan natin itong mga activities na na dapat nagagawa pa rin habang tumatanda ang isang tao.
Importante din na nakikita natin yung elderly na kaya pa nilang kumain mag-isa. So, importante yun sa kanila or nagiging part sila ng meal preparation, planning, kung kaya pa. At saka yung kakayanin nila na pumili ng kanilang kakainin. So, i-involve natin sila.
Now, in some cases, aging adults are unable to carry out these activities on their own, and we need to provide them with adequate support so that they can continue doing these tasks independently. Now, there are also other types of daily living activities that aren't necessarily essential, but they need to be met just the same. Pag-usapan natin to, Ma'am Emmy, kung ano yung mga activities na maganda isama din ang ating mga lolo't lola para sa kanilang sense of independence as well.
Ay, na-excite po ang ating mga lolo at lola pagka sila ay may task ng shopping. So kung kaya pa nila, at the same time when they go to the supermarket, na pipili nila ano yung mga food items na gusto nilang kainin, at least matanong natin sila ano yung plano nila for the week or for the day na gusto nilang i-prepare or ma-involve sila sa paghanda, at saka ma-ensure na kung ano yung gusto nilang kainin, yun yung naisasama natin sa kanilang meal plan.
Aside from preparing the meals, also yung pagmamanage ng mga bayarin sa bahay, paying of bills, and even taking their prescribed medication on time is essential for their sense of independence. Now, many older adults find it difficult completing these activities on their own, and we suggest taking an honest look at where they need assistance and find the solutions from there. Now, having a conversation with them helps as well. Sometimes our older loved ones don't realize the changes that are not only affecting them, but the people around them as well. For example, one of the obstacles older adults face when completing their tasks is impaired mobility. Dr. Mark, I'd like to talk about this. As a person gets older, their mobility becomes impaired as well. What are some of the recommendations to help improve this?
Isang common condition is osteoarthritis, wherein they have a lot of pains when they stand up and try to walk. So we can address that with taking certain medications that are safe for the aging population, such as simple paracetamol. And una, it's very important to figure out the cause for us to help them function and do their day-to-day tasks. Once we figure out what those things are, then it's easier for us to help them do their day-to-day activities. So, yung mga functional activities is very important. Yung paghawak ng kutsara, kumakain sa lamesa, rather than sa kama, sitting on a chair rather than lying flat in bed, na it will just promote sleeping. Dapat gising sila sa umaga, and minsan nag-iiba yung day and night cycle ng pasyente.
How can our viewers make their home more friendly to their elderly loved ones?
First and foremost, yung medications. Kasi there are medications you are taking before when you were much younger na okay naman siya, na baka hindi na siya appropriate as you get much older, na you might develop side effects na baka you're not aware that this is a cause of the side effect, because there are some medications which increases the risk of somebody falling. Okay, mga may tranquilizing effect, yung sedating effect, yung usual medication like diphenhydramine that you're taking for itchiness or for lack of sleep when you were younger, it just makes you more confused as you get much older. So simple things like that. So you have to discuss that with your primary care provider. So it's very important to make the environment safe. So walang loose rags, a carpet.
Ano kaya mga dapat na safety equipment ang ma-install sa banyo para maprotektahan ang ating mga elderly?
So having a grab bar, yung grab bar is very useful. Yung having a simple chair when somebody's taking a bath, na versus nakatayo sila, na baka ma-unsteady sila and that's a risk for falling. Those are things that you can do. Yung toilet na medyo high seat na toilet, it helps you stand up after you have your bowel movements, mas madali tumayo compared to medyo mababang upuan sa toilet bowl. May mga seat risers that you can use. Tapos non-slip mat sa bathroom.
Now, as we get older, our bodies have different needs, so certain nutrients become especially important for good health. More on this after a short break. Your health is our mission here on Med Talk Health Talk. You're watching CNN Philippines.
kasi mangot ka? Alam ko na. Masakit ang katawan mo, ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya sa bawat pahid.
I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines, where caring is our calling. Ma'am Emmy, how can we sustain the healthy lifestyle of older adults kapag nawawala na sila ng ganang kumain? Paano natin ma-meet yung kanilang nutritional needs?
Yung kakainin nila dapat should be nutrient dense. Ibig sabihin, kahit konti lang yung quantity, sisiksikin na natin yung nutrients na pwede nilang makain. And mas advisable then to give the food or the meals at more, yung interval should be more often. So small frequent meals would be appropriate for the elderly people.
So as opposed to adding yung mga typical na panglasa ng pagkain tulad ng asin, ano kaya mga alternatives ang pwedeng ilagay sa pagkain para magkaroon ng lasa pa rin ang pagkain pero masustansya pa rin?
We make use of natural herbs and spices po. So mas maraming bawang, sibuyas, at saka yung mga available na basil leaves, at saka yung mga iba-ibang condiments po na mababa ang sodium pero mataas ang flavoring. So maganda din po na yung mga kalamansi or lemon maibigay natin sa kanila kasi ito din yung makakapag-ayos ng kanilang sense of taste and ma-entice silang kumain.
Dr. Mark, what are some of the light and simple physical activities that the elderly can enjoy with the family in the comfort of their own homes?
Simple things like you're watching television and you're sitting upright, that takes a lot of postural muscle, and pwede kang tumayo for a couple of seconds, then upo ka ulit while watching the television. Or maybe walking around the house and you have a pedometer na you want to achieve a certain amount of steps in a day. Kung medyo hirap tayong maglakad because of certain conditions like osteoarthritis, using a cane or maybe a walker might be helpful for us to achieve these targets.
Today, being vaccinated is still the best protection against the virus, but many are hesitant to receive their doses. Dr. Mark, what can you advise to our viewers? How can we remind our older audience the benefits of immunization?
What I tell patients is, if somebody will get severe COVID, ma-admit sila sa hospital, or critical COVID, matutubuhan sila, it's not the younger person, it's the older person who has a lot of medical conditions, comorbid conditions. And yung risk of dying if you get admitted to a ICU is really, really high. And if you look at the demographics, ano ba yung pasyenteng who get severe and critical COVID? It's the elderly population, 65 and above. And it's very rare for me to see very extremely old adults like above 90 who survive a COVID infection. And although maingat yung mga elderlies natin kasi, you have to understand na siyempre yung iba natin kasama sa bahay, they have to go out to work. And you're not entirely sure kung sila yung magdadala ng COVID sa bahay. And this vaccination will work dun sa at the age group with most higher risk. It's not really me, it's not you, but it's the elderly population.
Importante din ba ang flu vaccine, ang pneumonia vaccine na kunin ng mga elderly? What's your advice on this?
Every one of us needs to be vaccinated for flu vaccine, old or young. Bawal lang siya if you have some form of egg allergies, which most of us don't have. Tapos with pneumonia vaccine, yung benefits kasi ng pneumonia vaccine is to reduce your risk of getting really a bad pneumonia that you get hospitalized.
Ma'am Emmy, do you have any tips for our older adults to keep them healthy?
Eat on time. Tapos, gawin nyo po na pag kumain kayo, siksikin nyo na po lahat doon yung inyong kakainin. Don't forget na kailangan nyo pa rin uminom ng gatas, kailangan nyo pa rin magprutas at saka gulay.
We hope you found our conversation helpful. Thank you to geriatrician Dr. Mark Henry Hoven and nutritionist dietitian Ms. Emelita Ong Lavilla for guiding us today. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines.
O, anyari sa'yo? Ba't nakasimangot ka? Alam ko na. Masakit ang katawan mo, ano? Sa sobrang trabaho? O di kaya masakit ang ulo sa sobrang stress? Break ka muna. Hinga ng malalim at imasahe ang ulo mo gamit ang Herbalaya Liniment Oil. Ako rin ganun eh. Kaya pag mataas ang tensyon sa trabaho, mag-Herbalaya break ka muna.
Herbalaya Liniment Oil. Amoy na kaaya-aya. Sa bawat pahid,
RPN, Radio Philippines Network Incorporated, DXKO. 1368 sa dial sa inyong radyo. RPN DXKO, ang radyo ronda dini sa Dakbayan sa Cagayan de Oro. Sidyahan na may galaon sa katawhan, andam na serbisyo sa tanan.